Okay, you guys have been asking and I have been listening. You guys have been dying for me to do a podcast on surgical menopause and hysterectomies and the whole journey. And so here we are. I have Dr. Juliana Hauser, who is so nice to come on. Second time on the podcast. Thank you very much. Dude, we were baby podcasters
We were.
when
I
you were
know.
when you were on the first time. I asked my VA to dig and figure out what number it was because I didn't have time to look today. But it's back there.
But I remember when we looked before, it didn't even have a number.
Yeah, it was before I numbered
first
the
season.
That's
Yes.
how much trust I had in that this was going to keep happening.
Right, great.
Now we're in the 300s and we're welcoming you back. Thank you so much. We reconnected because we were on stage together in Florida at Dr. Vonda Wright's event, which was amazing at the end of 2024.
Incredible.
And we were instructed to talk about sex.
Right.
And so we had a chat and
it was so
we got
fun.
to reconnect.
We could have talked for hours.
I know. It was super fun. And so you're so kind to come on today and tell us about your journey and catch us up with what you've been on surgical menopause. Tell us the other unique thing about you and your story is your background as a sex therapist and understanding midlife, treating how many unknown midlife people who've also had this journey, and now you personally went through the journey, so you have that like double lens to share.
Yes. Yeah, it was interesting to get to the point of making the decision to have the surgery. Both my mother and sister had hysterectomies in their early 40s, and my mom kept looking at me saying, "You're a ticking time bomb. You're a ticking time bomb," and that messaging wasn't landing with how I was experiencing my body. But then there was this voice, well, literally my mom's voice, but also in the back of my head going, what if you're making a mistake? What if you're waiting too long? And all of this was happening when perimenopause, menopause was starting to become a much bigger part of the conversation and healthcare and a bigger part of my work also. So I waited and waited and waited because I didn't have symptoms that I needed to. It was going to be completely preemptive, and that didn't feel right for me in the choices that I was making with the knowledge that I had and the conversations I was having with the experts in the country. And then I started having pretty significant symptoms. It just almost like for me happened pretty quickly. And I realized that I had a fibroid. And I watched it, and I had a really good medical team. And I joke that when I like to teach people how to go to a medical appointment, I say, "How much do you care about my sexual health?" And how a provider responds to it. I joke when I have options with healthcare is how I stay with them or not. And I love watching how they respond. And I love the ones who are like, "A lot." And so let's talk about it. And when I started having, my period was coming every 2 to 3 weeks. It was miserable. And my father is a radiologist, my mom's sister, a lot of people in my family are in the nursing medical community. And I kept hearing the line growing up, interfering with the quality of life. And at that point, it absolutely was. And interesting. So I do a lot in the sex space. I do a lot in my private practice revolved around sexuality. I make a point to be comfortable in my own life. And fascinating when I started talking about it impacting my quality of life. And my doctor, who I love, said, "How?" I had this weird feeling of like, it was hard for me to start talking about my sex life. And I know better. And I teach this, I speak about this. And I was like, well, it really sucks that, we're like making just a mess. I mean, how many sheets have I had to buy or comforters have I had to buy? Because I was ruining it with all the bleeding and I wasn't feeling well. And in July, I was officiating a wedding, and when we got the pictures back, you could see my fibroid. You could see it. I could tell what it was. Anyone else may not notice it, but I could see it in my dress. And I was like, okay, it's everything about this is wrong for me. And I had a lot of research at my disposal, and I started interviewing physicians in the area of who I wanted to do the surgery, and getting consensus as to what it was. And that I paid for it on my own. My insurance wasn't going to pay for me to have these consults, and I was happy to do it. This felt like a very important decision to make, because I needed to make a decision if I was just going to have the fibroid, my uterus taken out, or if I was going to have everything taken out. And with everything, was it going to be my ovaries and my cervix, or just my ovaries, fallopian tubes, and all of that? And again, I can't say enough how I felt so informed. I felt so confident going into these, except, once I'd gotten past, like, revealing that this was affecting my sexual life, which wasn't the only reason why I was considering this. I was floored how many decisions I had to keep making. And
It's a
and
lot.
yeah, it is a lot. And I felt so informed going into that. And I'd leave an appointment, and the physicians I was interviewing were incredible. There was nothing on them. It was, I didn't know. I didn't know. And I appreciated they were giving me agency in making the decisions. And they would say, this is what I recommend. And then here are your options beyond that. And here are the consequences of all of these things as well. And for me, one of the biggest factors beyond that, and reason why my mom was saying that I was a ticking time bomb, was that I had ovarian cancer in my family history. And that was another reason why both of them had it. So I had that, and this unknown factor as well about making it. But I had been doing retreats with Dr. Vonda. I had been doing lots of conversations with here, compiling all these women's stories as to what it was like to be in menopause. What I couldn't find was a lot of people who had their experience of going into instant menopause through surgical menopause, through having a hysterectomy. It was very hard for me to find anybody that was doing it. It was a person of a friend, or I was looking online for groups, and I found one, Hyster Sisters, and I got a lot of information from that website. But I started having experience, like when I had a miscarriage, and I started asking people, and realizing there were so many more people that had it, that they just weren't talking about it. I felt the same way with surgical menopause. I actually knew more people that had it, but no one was talking about it. So that's usually when I start talking more, is when I realize that no one's really saying it. So I started talking about my experience, and I started documenting it. And I remember at one point I was sitting against my bathtub, crying, taking a video. I was like, oh, I've turned into one of those. I'm one of those women crying, videotaping myself. And but I videotape myself every single day, from the decision that I made to have the surgery to 2 weeks afterwards. And the roller coaster of emotions that I went on was remarkable, and feeling isolated was one of them.
Yeah. Well, absolutely. Especially if you don't know other people who've gone through it, who aren't like, your mentors,
Mm-hmm.
right? Of like, what's it like? I think surgery is such a foreign thing. Like, I tell people, I'm like, I do it every single day. And when it's my turn on the other side, I will probably behave just like all the patients that I see behave. Because then it's real, and it's a completely, like, by definition, surgery is a lack of control. You have anesthesia. You are in the hands of other people. It's a very lack, and people are like, I don't know why I feel this way. It's like, because you're losing control for a little bit, and that's a very scary thing. Even though it's a very controlled
Mm-hmm.
lack of control, like, it's going to happen at 8 a.m. on Tuesday, right? It's very
Right.
scheduled, like, about how long it's going to last.
Mm-hmm.
Like, you can kind of prepare for it, but it's still a very lack of control thing to do. I want to back it up just for people who don't know. The removing the uterus doesn't always cause lack of hormones. The ovaries are the hormone producing organs. That said, with a hysterectomy, even if it's just a uterus, those people can go into menopause earlier, likely because of blood flow affecting the ovaries. So it isn't always like you have to have the ovaries out in order to be in menopause. Certainly just, and I think that was the big misnomer for a while.
Yes.
Like, you kept your ovaries. Is like, yeah, but they might have a shorter lifespan because they've been affected by blood flow issues, or, for whatever else.
Mm-hmm.
So surgical menopause doesn't always mean everything had to be removed. But that is kind of the more common way when people talk about surgical menopause, is to mean the ovaries went in a bucket with or without the uterus. So I just wanted to back up for people who might. Do you want to clarify the definition of surgical menopause any more for people?
Well, it was interesting when I started going through my options that there were about 8 different ways, quote, ways to have a hysterectomy, which I didn't understand as well. And again, I'm in this space talking about that. I didn't go to medical school, but I am talking to so many people and in the rooms with all the experts. I really thought that I understood what that meant and had family members that had it. So, I think your clarification is really important. And it was something that when I started asking women, have you had a hysterectomy? And then going like, was it this kind? Was it this kind? Number one, I was shocked how many people didn't know.
Yeah. Yes.
It was, and then they would say, I'm embarrassed to tell you, I don't know if I have my ovaries or not. Yep. And their surgery had been 2 years previous to the conversation. This is not something that happened 15 years ago. And in particular, when I ask people, do you still have your cervix? It's probably 80% have no idea if they kept their cervix in it in their surgery. And so I think there is still a lot of confusion as to what the names mean, partial, total, all of that changes, and we have to inform ourselves of the terminology to even with the doctor that you're speaking with, because I found that could be different as well. And I needed to have a body part. So I started asking when I was talking to all three, I was like, show me a diagram. And I wanted to make sure that I understood exactly what they were saying, because for some, total or radical maybe have a difference, but for others, it could be the exact same thing. And to your point about those who I spoke with who had kept their ovaries and fallopian tubes, they also talked a lot about the change and they felt pretty invisible in the space of menopause. They felt really confused. This isn't everyone, but just the ones that I was speaking to, because they felt like, well, you didn't actually you really didn't go into menopause because of it, but they were experiencing it and having vast changes and didn't feel as prepared because they had kept their ovaries and fallopian tubes. They didn't think that they were going to have any menopausal symptoms, and they did.
Yes. A couple all of that. I had a man ask me, a non-medical guy. I was doing a podcast a while ago, and he's like, my buddy told me that if a woman gets a hysterectomy, then she doesn't go through menopause. Is that true? And it's like, okay, well, that's out there also, right? And so it's like the exact opposite of what's happening. I think most gynecologists hate the term partial hysterectomy because it's so, what is partial? Like you're still if partial just means your uterus and not your ovaries, but it's still your whole uterus. It's not half of your uterus. It doesn't explain what happened to the cervix, right? So I think most gynecologists, I don't want to speak for the entire department of gynecology, but I think most of them hate it because it is so confusing and lack of clarity. But like the lay terminology is not going away at this point. So like you said, you got to be I love the diagram idea is like, okay, what's the pros and cons of keeping your cervix? Because is that still, are we still calling that a partial hysterectomy, right? Is that a subpartial hysterectomy? What do you call that? I think the other confusing thing with the cervix is, number one, you still need cervical cancer screenings afterwards. But number two is the role for not all women, but many women in preserving vaginal length and also deep vaginal sensation and the different nerves that are targeted via the cervix versus clitoris. And that doesn't matter to a lot of women, but you don't know unless you ask. Exactly. And I would say most people are not asked about that in deciding, like, they're just like, oh, take your cervix. They don't have to get screened for cervical cancer. It's like, yeah, but cervical cancer is actually quite rare and you haven't had it yet. And now we're vaccinating more and more people against cervical cancer, right? So is it just put it in a bucket because you won't get cervical cancer? That's oversimplifying a complex situation.
Agreed. Mm-hmm. And that felt tricky because I realized when I was educated with that information, I wanted the answer, you won't ever be at risk for this again. I thought that was going to be my, like, check, you're okay on that.
It feels good.
Right. And when I realized it's significantly decreases it, but it doesn't make it 100%. It wasn't as easy when I knew some of the other aspects of it that I was concerned about with my sexual health. And the surgeon that I went with, we spoke for at least 15 minutes, which is a long time in a doctor's
It's a
appointment,
very long time.
just about preserving my sexual pleasure and what were the options that I had to make sure that that was going to be something that was prioritized with everything else. I didn't want it to be last on the list. I wanted it to be something, I wanted to know what my options were. And I greatly appreciate that she gave me that time and didn't push it off, and really made it as important as every other aspect of the decisions that I was making. And I greatly appreciated that. I didn't feel embarrassed, like the personal aspect of it, saying like, I'm afraid of what it's going to feel like afterwards. I'm afraid that this will be like the last orgasm that I have, even though I knew better than that. I still had the fear for myself. And I realized how, I mean, I think a lot of people have fear going into surgery. I realized that I felt like I had a lot at stake with this, being in the space and speaking about it a lot too, and being someone that's doing a lot of work with clients with sexuality and wanting my own pleasure to continue. I feel very young to that, and speeding ahead what my recovery was, absolutely have had zero effect on my sexual life and my sexual pleasure. And in fact, like the first orgasm I had after surgery when I was allowed to have it was fantastic. And I remember crying. I actually cried. It's like, oh, thank goodness. It's I'm okay. Like,
Yeah,
everything's okay.
totally. The motor runs.
Mm-hmm. Yes. I wanted to go back and actually talk about something that I don't hear a lot in about the conversation of menopause too, which is, so I was expecting when I made the decision that it was going to take a long time to get in for surgery. And so I was thinking I would have 3 or 4 months. In fact, I had it before the event that you and I spoke with. I was afraid it was going to happen right before it and I wouldn't be able to make the event. And she's like, oh no, I can get you in 3 weeks, 4 weeks. I was like, what? Like, I need time.
Hey, I thought I had time to prepare, but,
That's right.
But thank you.
Yeah, because I actually wanted my last period to have some meaning to it. I wanted to have a goodbye for it. And I realized that I had a really pretty big intersection with my mental health. I was so excited to be free of the symptoms of the fibroid. And I couldn't get that quick enough. That would have been the next day if she could have done it.
Mm-hmm.
But I didn't have enough time to kind of say goodbye to this phase of life. I also started feeling some of the things I was looking up, some of the articles that were already out there were a lot about like my womanness being gone. Like, what does that mean not to have a womb anymore? And before it became relevant to me, that conversation seemed interesting. I felt like, oh, you just changed the terminology. When I realized that was going to really impact who I was, it became very personal, and I started grieving ahead of time, and I wasn't prepared for that either. No one was talking about the loss of it. Mm-hmm. Everyone was saying how much I'm going to feel better. Mm-hmm. And I remember one of the doctors that I work with, who I then switched over to do my hormonal treatment afterwards. She held my hand at one point. She's like, you have been feeling miserable for so long. I am so excited to talk with you after the surgery. You're going to feel so much better. And that was just beautiful to hear that. And she was correct. But I didn't have anyone saying, how are you feeling about this aspect, which is not their job, like to talk about that. That was why. So I ended up hiring a menopause doula who is, she came to our event or your event in Seattle that we got to speak to. And I was so grateful to have that conversation. I met with her every week leading up to the surgery, and she was one that asked, how am I doing emotionally? How am I navigating? I'm also unpartnered, so I had to do all the figuring out of all the decisions, and I have a young daughter, making sure she was okay, who was going to take care of me. I had a lot of things I was in charge of on a very quick time period. Mm-hmm. And I'm so grateful that I gave myself that space to talk and to say goodbye to that phase of life, and to say that it was important. I kept saying, gosh, I wish there was a party. I wish there was a ritual for this. And I felt lucky. I actually knew when I was going to be going to menopause, because a lot of the stories that I hear from women, and I work with women, they don't know. I mean, it's just such an unknown and such a vague time period. So I felt like, well, I could actually plan the party. I could know exactly what my date was that I went into menopause. And also I wanted I wanted there to be women, quote, waiting for me, like, metaphorically waiting for me, saying, it's great. It's wonderful. Welcome, 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 welcome. And there wasn't such a thing. So we started making one up. And actually, the night before my surgery, in my backyard, we took the rest of, or some of my products, and burned them. And we did a goodbye to the period bonfire, and it was a really lovely way to usher out that phase of my life and go into a new one. And I think it made a really big difference in my recovery afterwards too.
That is so cool. And like, I know that you will help other people think that they now have permission when they want to do that. You can even, and for those who are listening, you can even do an anniversary of. If you missed the original party, you can do an anniversary of, and not miss a party. But I want to get into the hormone journey, but we got to hit on doulas for a hot second. For people who don't know what a doula is, or who think it's just for giving birth, what's a doula, and how did you know that that was a thing that you wanted to support yourself with?
I was having a conversation with my just amazing Caitlin, who's on my team, and I said it to her. I was like, I actually didn't think I wanted a therapist. Because again, we're not really trained in this either. And I thought I didn't have time to find someone who was an expert in it. And I said, but you know what I really need? I need a doula. And I thought maybe I'd made it up. And she knew somebody who was a postpartum doula. She talked to her, who was in the Seattle
doulas
area.
Know each other. Yeah,
yes, okay. Right. And she's like, well, I've never done this, but I know what you're asking for. So if you're okay co-creating this with me, then let's go for it. Let's try it. So we made it up together. And then we were probably 3 sessions in, and she's like, do you know there is a menopause doula certification? Like there is this out there. And so we both started looking into it. And now I feel as passionate about menopause doulas as I do about pelvic floor therapists. That I think you don't have to, I think you shouldn't hire one just if you're having a hysterectomy. I think it should be for everybody. The space that she held for me and the information that she grew, and if she'd already been through her training, which she would have had waiting for me, would have been amazing. And I don't know if you feel this way also, but when you are already an expert, it can be really hard to lay the expertise down and be held and not be the expert in that space.
Yeah.
And she just in such a skilled way knew exactly how to honor what I knew and also give space for what I didn't, and then held that space for me and reflected what I was saying when I felt like I was babbling and not knowing what I wanted and what I was going through. And I recommend it highly. And there's people who are certified in this. There's an organization that is specifically for.
Do you know the name of the organization?
I think it's called Menopause Doula Institute, but I could look it up.
Good for them to keep it simple.
Yes, right. I could be wrong on that, but I'll find it for you for the show notes.
That's all. I kind of want to have your menopause doula on the podcast now.
I'd love for you to have her. She's outstanding and a very good soul, and she's an amazing history that led her to this. As well. And
nobody's like in senior in high school and they take the career aptitude test and they're like menopause doula. When you're 50.
Right.
There's always a good journey.
Yeah.
That's so good. And you keep in contact with her to this day.
Yes. Yeah. And the other thing I did is I hired somebody to help me do, she's a therapist that I do know who does like hypnotherapy and does a lot of guided imagery. And so I hired when Scylla and I were talking about, I wish there was this party. She's like, well, or this ritual. She's like, well, why don't you make a guided one? And I knew exactly who I wanted to ask. Caitlin Peterson, she's amazing. So I wrote her and I was like, hey, how would you feel about doing this guided imagery thing with me? And she's like, said the same thing. I'm not an expert in this. I've never done it in this detail, but yeah, let's go for it. So we met and I told her what my dream was. And it was like, it was in the woods and there was great music and there was a bridge I went over, like all these very woo-woo things. And then she took some time and came back with me and did a guided imagery session. And it was all virtual. I closed my eyes and she guided me through the process. And my body felt like it went through it, but it hadn't actually gone through. And that brought me a whole lot of peace going into it as well. And so when I got to the day of my surgery, I think overall, I felt I really showed up for myself. and I wasn't embarrassed to ask for what I needed. What I needed may not be what other people need. Like they may not need a guided imagery, walking into a wood party, a goodbye tampon party, but I did, and I had those meetings with the physicians. I picked my doctor. I know there's a lot of privilege with that, but that's what I would say. I walked away, number one, feeling like I walked in with agency. I walked in saying this is, because as you said earlier, there's a lot that feels out of control in this experience. Menopause feels a lot of out of controlness in it, which is what I hear a lot in my work and as a therapist with my clients, and felt it myself. I'm going to be compiling the video. And when Caitlin watched the video, she's like, whoa. She's like, you were up, you were down. They were, and that was like within one day. And I made it matter. And that was something that I had said to Scylla, that I said, it feels like it doesn't matter that I'm going through this. And I know everything is going to change for me afterwards. So I want this to matter. And so I found the ways that would help me make it matter.
Oh, I love that. Thank you so much for coming on and sharing your story. Did you wake up with an estrogen patch on? Were your doctors like, oh yeah, obviously? Or were you like, hey, let's have a plan? Like, who kind of steered that ship?
Partly I ended up waiting 2 days, and that was just because of my levels, something that was happening with my surges.
Sure.
But we had it already. I had everything planned out, and as things go, something that I found really interesting that I didn't expect was my skin wasn't absorbing anything. So my topical testosterone and my patch, my numbers weren't there, and because I didn't know what it was supposed to feel like. I didn't know that it wasn't happening until we did my numbers.
Yeah.
And we had been doing a lot of numbers, and I was paying for that out of pocket too. I wanted to have a whole lot of different numbers leading up to it. So we had to move through different ways, which I haven't heard, I know you do this, but like, I didn't know anybody personally who wasn't doing a patch and who wasn't doing gel. So that was, it was a lot of feeling alone and not making that feel wrong and be wrong, and continuing to educate myself, like my body's just different, and there's a lot of options out there, and I'm going to keep asking, and I'm going to keep advocating for myself, and I'm going to keep checking in with how I am and what I need.
I love that. Yeah, let's normalize that a second for people. So about 20% of people are, when I say poor absorbers, like you failed a test or something.
Right.
You have thicker skin. Your skin is more resilient to, absorbing things from the outside world, which is a kind of a compliment in that way. Same with men. About 20% of men are poor absorbers for testosterone. So it's not like women are weird. It's just that all skin is different.
Right.
And, when I think we lose that message when we kind of harp on transdermal as being the go-to bread and butter, blah, blah, blah. And I'm like, you got to start somewhere. You got to start with like the easy, the cheap, because otherwise it's too overwhelming for people to be like, hey, well, there's going to be like 8 different things you can do. Like, that's not as kind of grounding as like, hey, let's start with what's common, but we can always adjust as needed. When you when you were on the transdermal, if you mind sharing, did you switch to oral? Did you switch to injections? Oral. Okay. Were you like, oh, I feel this now? Like, was it like, did it turn on when you were on the right dose? How did you?
It took a while because the liver pass through was my liver was working really well also. So it took a while for it to build up as well. But once I got to the levels that I wanted to, I was like, oh gosh, wow, do I feel different? And same with testosterone.
Yeah.
That was a game changer for me, frankly. That was the biggest of, like, once I got that dosage right, I felt like myself again.
Yeah. And injectable, oral, do you want mind sharing?
I did actually end up having to do pellets.
Oh yeah.
And
pellets. Okay.
And it was, again, I mean, and again, being in those conversations, and it felt like, oh no, this is the worst thing ever.
Yep.
I was pretty scared to try that route. And but I actually remember a woman in one of the retreats, she stopped, she said, I want to advocate that there are just some people who none of the other options work.
That's right.
And I don't want us to be afraid, because she and honestly, had I not remembered her saying that, had she not had the bravery to say that in front of me, and I was speaking, actually, we were standing up talking, and um, it helped me to say yes to something that I had felt scared of,
Yeah.
and had felt like it was something wrong. And again, like as you were saying, I felt like something was wrong. I was doing menopause wrong because I wasn't able to do like the preferred route of all the medications. But as of now, I really feel wonderful. I'm so grateful, and I walk around just saying I feel so grateful we live in this era.
Yes.
And I've had some really interesting conversations with my mom and my sister who had their surgeries many, 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 many years ago, and what they had at their disposal compared to what I have.
Yeah.
I'm so grateful
Yeah.
for the options, for the conversations, and for menopause being in a very different place than it was.
Yeah, we have in America, I would say the UK also. Canada doesn't have Canada and Australia don't have the crazy access like we do. Like we're literally like, you want a pill, you want a patch, you want a gel, you want a spray, you want an oral, you want an injection, you want a pellet, right? Like we have this embarrassment of riches, and with that comes the like, are you doing it right though?
Right.
And we get very comparison-y with that. Like, what's your dose? And people don't understand that like what dose you're giving somebody isn't what that ends up being for that person. But via the way your skin absorbs, the way your liver metabolizes, the way we can't measure your receptors. Do you have more sensitive receptors? Right? It's like, you lose all of that. That's why podcasts are so good, because you can get into it. But it's like, I hate the comparison. I hate the dosing comparison because it's meaningless. It gets some very good people into trouble because they're like, they put them on such high patch doses. And it's like, some people need high patch doses. It's not that they're a bad doctor. They just, that doctor knows a different dose is going to get somebody to a different level compared to Susie down the street. Was your sister and your mom supportive of you going on hormones?
They were scared.
Yeah.
Especially my mother. And with my father being in the medical community, we were looking at his practice, and my mom was thinking through it, and it was very few of the wives, because they were all males in his practice, who had their uteruses after a certain age, that it was just like, get it out. You don't need them, get them out. You don't need them, that mentality.
Yeah.
And I think it was hard for her at first for me to go about this differently and to trust that the information that I had access to was accurate. And
you're like, all of my friends are wrong, Mom. Or
yes,
I've been listening for a while.
Would you like to see who I'm speaking to? And I'm telling you, these are the experts in the country. And I know it's different.
I'm hanging out with the wrong crowd, or I might actually know something.
Yes, yeah. And the other thing too, which was fascinating, is they also felt very different about. They couldn't relate to me worrying about what was it going to feel like to not have a uterus anymore, and back to that aspect of like still feeling like a woman. The conversation went nowhere because they're like, no, I was just so grateful. Who cares? It's nothing. Which is a very valid way to experience it. Also, mindset. Yeah, and nothing wrong with that. And we were just kind of looking at each other like, yeah. Different, not wrong, just different, and I worked through that. For me, I really didn't, and I didn't think I was going to feel that way, of feeling lesser than or looked at differently, but I did for a bit, and I was only 2 months post-op when we were on stage together, and still figuring out where I was hormonally, still figuring out how I was, how my life was going to be post-surgery. One of the things that I wasn't expecting was I got a walker. I got all these things. I look at this to-do list. I was expecting not to be able to move very much, and within hours I was walking very easily. The robotic surgery was something I hadn't thought about. I thought it was going to be 10 times worse. And I could have, I joked, I could have been doing dancing. I could have danced to the next day. And I felt so grateful.
You are a fit person. You care about your body strength. And it's like, people don't realize how strong you are going into surgery matters huge.
Mm-hmm.
Absolutely
Yes.
matters huge. And mindset matters huge,
Yes,
right? If
which is
you're
a lot of why I was doing the doulas. I really wanted to
yeah,
have a good mindset.
yeah,
And nutrition. I quickly started talking to my nutritionist friends and like, what do I need to be doing to prepare for the surgery?
yeah. Were they
I got
like
it.
protein, protein, protein?
Yes, yeah,
Yeah, yeah, yeah.
and I did some really healthy soups the couple days leading up to the surgery, and I work with a hair loss company. I talked to them about being proactive before the surgery. I mean, I was doing everything I could think of. I mean, you'd think, yeah,
That's awesome.
it's an important surgery. It's a major surgery, but in some ways, I dove in a whole lot more than I normally would have.
Yeah.
In some ways, because I wanted to know if it made a difference and how I felt and how I was interacting, and it did.
Does your experience with surgical menopause and your preparation for it and your experience with hormones after it, all the pieces, does that now translate into how you're caring for patients with your sexual therapy practice?
Absolutely.
Tell me that.
It I know to ask follow-up questions more than I did before. And again, I would have thought I was acing it, acing it. But I know to say, like, so, not just are you feeling different, but how are you feeling different? And following up after that. I've been doing this survey about mental health, the impact of perimenopause and menopause on mental health. And there's one question on, has anyone told you, or have you thought to yourself, I feel different? And the statistics are staggeringly high.
It's
And
very high. The not feeling like myself is about 60% in perimenopause.
which is extraordinary.
It's very
Um,
high.
yeah. And I wasn't understanding some of the complexity of the rise of anxiety, the rise of depression. I wasn't. I wasn't sure, and I'm not sure research has really been enough yet to know, was it just hormonally based? Is it where we are in our relationships and our age and all of that? And then I haven't seen any research that then adds surgery on top of it. So what is that aspect, or the quickness of the change? When I went in, my estrogen was extreme. It was triple digits,
Yep.
which is really high to go from that down to zero within a week. I mean, that was really hard on my body to go through.
Could you feel it? Did you have hot flashes?
No, I didn't. I didn't have any of that. And because it stays in your body, you still are having it for a bit. So by the time we think it was still, that's why I waited.
Yeah.
Because we thought I'd probably still have a higher dosage. So I had warm flashes.
Yeah.
That's more what I had. But I felt I certainly have felt an increase of depression and an increase of irritation that I didn't have before. And my daughter's about to hit puberty. And so I've actually been talking to her a whole lot about, I was like, I'm having some different feelings in my body that aren't, and I say this to her, I was like, that aren't related to you or the environment. It's just happening in my body. And I need a moment to go be a better mommy. And I'll walk away, and we've talked about it. I was like, that's how I want you to explain to me when you're going through puberty, how you're feeling. You'll have a different version of this, but I've been trying to model it for her without making it be this dismissive or this joking kind of comment. It's legitimately happening, and I have to now figure out how to regulate my body differently. My emotional regulation is very different now than it was before the surgery. And I've had to work hard to make sure, and I do that with my clients too. And so now anyone that I know that is in the phase and they're close to like the year mark, or their perimenopause phase is pretty difficult, or they're going through surgery, I start talking about mental health immediately, and then talking about how to have the appointments differently too. And I share my experience. It's just one experience. There's so many different versions of this.
Totally.
And that's like the story that I share. It's just my story, but I think it's important to share it. I wish I had been able to go on a website and just read story after story after story, or heard videos of women speaking about it. It would have made a big difference for me leading up to it.
Yeah, totally. Well, before we're wrapping up, I have to talk about the advice you gave on stage at Von der Wright's thing because I used it and I actually wrote about it in my new book coming out. I wrote about
that's
it. So you're
great.
quoted in there. So you were on
Thank you.
stage and you said, ask your partner what you're good at in bed.
Yes. Mhm.
And I was like, God, how did I had never heard that one before? Right. And
Yes,
so
yeah.
like literally like I got home from the conference and I was like, what am I good at? And
That's
so
good.
my husband told me what I was good at. And I was like, really? And he's like, yeah. And I'm like, you're telling me we've been together for almost 20 years at this point, and I didn't know I was good at that. And he's like, ah, like, you know, and I'm like, so I just like bow down to you now because I'm like,
So
dude,
sweet.
everybody needs to do that, whether it's a brand new relationship or you're 30 years in. First of all, everybody loves knowing what they're good at. Like,
Yes.
it's the best feedback to get.
It
You know?
is.
And then you can ask your partner, like, you know what you're good at? I'll tell you what you're good at. Like, everybody loves that. So, like, huge, like, that is like the pro move. I'm writing about it in my next book.
Oh,
Thank you for that
That's great.
pro tip.
Thank you for saying that and for noting it. And I love it that you went and asked him for, because that's part of the thing too, is if we don't know how to have those conversations or ask those things, then we don't know what questions to we don't know what the entry point is. And in my work, one of the questions that came from is that I love asking people like to rate themselves and to say what they think they're good at. And we use it. We have time for a quick example of how I use this. So one of the clients, and she's allowed me to tell this story, is I was actually working with her on career counseling, and which is not what you would think for sex therapy that you'd be talking about, but I'm able to put everything in the context of sex. And we were kind of at a hurdle in insight, and I said, okay, it's like, tell me the 3 things you're best at in bed. Wait, what? Like, I know you do sex therapy, but that's not what we're doing here. I was like, no, answer me. And she's like, well, I know what it is. And her number one thing was risk taking. And she, in the environment of a sexual relationship, she's a big risk taker and she loves pushing boundaries and going to challenging. And we went through like, what is the environment and her sexual relationship provide that allows her to be a risk taker? And we looked at that, and so we translated that into what she needed to be looking for in her next career move, in the next environment. And even though you wouldn't think it relates directly to it,
that is so badass.
It was very cool, and it works both ways too. And if you do that, you can often figure out really what you'd be best at in bed too. And there's such a wide range of things that people are really good at. It's not just a sex position. It's the 9 pillars of sexuality that I've talked about. You figure out within that, and when you figure out what you're good at, that you feel good about, and what your partner thinks you're good at, I think it makes a big difference in sexual confidence too.
I love that. So your book coming out September 19th, A New Position on Sex, A Guide to Greater Sexual Confidence, Authenticity, and Pleasure. Pre-orders are up now. And you have to send me a copy and come back on the podcast once that's out this fall.
Thank you.
But I'm absolutely looking forward to it. And I'm honored that you came on to share your story with us today.
Thank you. Thank you so much, Kelly. Thank you for the work you do.
Thank you.